Hi, my name is Josh, and I'm going to be walking through the bony landmarks associated with the humerus and the elbow joint. So to start off, we have the humerus. It starts up here at the shoulder and goes all the way down here to the elbow. It connects to the elbow through the trochlea, which is the lower end of the humerus, and it connects to the ulna in the trochlear notch. Those are both deep. You cannot palpate those. Some key bony features of the elbow are the medial and lateral epicondyle. So those are the two bony processes on the outside and inside of the elbow joint. The olecranon process right here, and the olecranon fossa, which is the little divot that the olecranon process moves into. If you're on the lateral epicondyle here, you can work your way inferiorly until you reach the head of the radius, which is right about here. And you can tell you're on the head of the radius by having the patient pronate and supinate their hand, and you can feel the motion of the head of the radius. Now we're going to be discussing the muscles associated with the elbow joint. So first we're going to start off with the anterior side here. And the first muscle is the biceps brachii, which is primarily responsible for flexion, so like doing dumbbell curls, but also partially responsible for supination. So if you have your arm like this and you flex it, you can feel that it kind of rotates your hand upward into supination. The brachialis, which is a smaller muscle along the lateral side and deep to the biceps brachii, and its primary function is specifically elbow flexion. And then next we have the brachioradialis, which connects on the lateral side and wraps around the arm, and it provides assists with flexion, but it also assists with supination and pronation to the neutral position. So if we're in supinated position, the brachioradialis will pronate until you're in the neutral position like this. If you're in pronation, your brachioradialis is responsible for supination until you get to the neutral position like this. All right, so the more muscles associated with the elbow is we have the triceps brachii, which is primarily responsible for extension at the elbow. We have the anconeus muscle here, which is on the lateral portion. It's a smaller accessory muscle, but it also works for extension. We have the pronator teres, which is if you come from the medial epicondyle on this side, it wraps around at an angle down to your radius, and that is primarily used for pronation of the forearm, so rotating your hand this way. The supinator muscle is also located on the posterior side here by the lateral epicondyle, and it wraps around to the radius here, and its primary purpose is supination, so holding a bowl of soup, supination. And the last muscle that we have to discuss is the pronator quadratus, which is down at the lower portion closest to the hand, and it connects the ulna and the radius together so that they can pull towards and rotate towards one another. And as the name says, pronator quadratus is responsible for pronation, so pulling the hand to turn it over like this.